non-smokers be prioritised over smokers on hospital waiting lists? Hi, my name is Miray and I argue that non-smokers should not be prioritised on hospital waiting lists. On the contrary, I believe that smokers should be prioritised as opposed to non-smokers, as they are greatly threatened by the health issues which correlate with smoking. Smoking refers to the practice of inhalation and exhalation of fumes burnt from the product tobacco. This prepared substance, through examination, has proven to have countless negative effects on the human body. Arguably, despite the fatal reality of smoking and the abhorrent effects it bears on the human body, the smoking industry in 2013 and 2014 was estimated to have generated a staggering $8.5 billion in excise revenue. Such evidence indicates that despite all the known cases of provoked deaths and diseases caused by this practice, the smoking demographic still choose to risk esteemed health and well-being for the subordinate effects that smoking bears on the human body, such as stress relief, relaxation, pleasure, refreshment, sense of acceptance, and maturity. Such a risk is explained by the unfortunate addictive reality of smoking, whereby the user seeks the drug in a compulsive, difficult-to-control state, despite the harmful effects that coincide with its use. Despite such short-term betterments, the detrimental consequences of smoking greatly outweighs any of the questionable benefits that this practice provides. Studies have shown that smoking in actuality is one of Australia's largest preventable causes of deaths. In 2003, tobacco was identified by the Australian Bureau of Statistics to be responsible for 7.8% of diseases and injuries in Australia. Considering the detrimental reality of smoking and the overwhelming population of smokers, as well as the addictive nature of the habit, it is a rational stance to provide smokers with prioritised hospital waiting lists, as their health is undeniably at greater risk in comparison to the average non-smoker. Considering that smoking is an addictive practice which causes chronic fatal diseases, then one would deem it necessary to prioritise smokers on hospital waiting lists. To further emphasise, studies have identified a wide range of health conditions to be caused by smoking. Such conditions include bronchitis, emphysema, asthma, heart disease, diabetes, cancer, stroke, eye disease, and renal disease. Considering the higher risk of diseases and injuries that smokers attain, it is also a considerable argument that illnesses which are not associated with smoking have a greater pathogenic opportunity to cause greater harm on smokers as opposed to non-smokers due to their weaker immune system and strength. Considering this notion, the perceivable state of risk that smokers are in is unmistakably greater, which thus would imply the need and crucial requirement for a prioritised waiting list to meet the need of treating those of greater risk of fatality and death above those of lesser risk.
Tobacco is the number one cause of preventable death. People who choose to make healthy lifestyle choices deserve the right to be prioritised over those who purposely make the conscious bad decisions every day to continue with the smoking habit, which has been demonstrated to severely damage one's health. Miray has stated that tobacco is responsible for 7.8% of disease and injury in Australia. There is a whole other 92.2% of disease and injuries caused by other factors, many of those involuntary, such as bacteria, parasites, genetics, etc. These are the patients that should be prioritised. Every cigarette packet depicts the gruesome reality of disease and illness which smoking causes, covered in unavoidable warnings, whether it may be the slogan, "Smoking kills," shocking images of a rotting mouth due to mouth cancer, or confronting images of actual people who have died from smoking. Yet billions of people continue to smoke each day, ignoring the vast amount of public awareness. Although smoking causes cardiovascular disease, it is one of the most preventable chronic diseases in Australia. There are many other diseases such as cancer, chronic kidney disease, diabetes, mental health, musculoskeletal conditions, oral health, and respiratory diseases, of which patients with these illnesses should be prioritised. People who choose to make healthy lifestyle choices have earned the right to be prioritised over those who purposely make the decision day in and day out, fully aware of their health risks, and continue on with this damaging habit. Miray mentioned that the evidence indicates that although countless cases of provoked deaths and diseases are caused by smoking, the smoking demographic continue to risk their lives. Despite the mass media campaigns confronting smokers with the numerous health risks, 16.3% of 18 to 44-year-olds smoked daily, according to the Australian Bureau of Statistics National Health Survey of 2014 to 15. By prioritising non-smokers on hospital waiting lists, it may provide an incentive for people to cease smoking. This in turn is more likely to prompt smokers to realise how essential it is to discontinue smoking due to the countless harmful effects and disease smoking causes to the body if hospital waiting lists prioritise non-smokers. It is stated by the Australian Government in terms of safety and quality that hospitalisations of conditions that are potentially preventable through population-based health promotion strategies are examples as alcohol-related conditions and smoking-related conditions, which gives foundation to the argument that hospitalisations due to conditions caused by smoking are very much preventable. So why should non-smokers, who are presented with the same choice as smokers to take up this fatal habit, be disadvantaged to smokers on hospital waiting lists?
Sophie has made a gratifying argument. However, the notion of prioritising smokers on waiting lists over non-smokers is not one which aims to discriminate or dispute human rights, rather to rectify the overwhelming issue of smokers' poor well-being and need for immediate help and medical care. It is an abhorrent fact that smoking causes premature death, with the life expectancy of smokers being 10 years shorter than for non-smokers. It is a rational and compelling theory that by prioritising smokers on waiting lists, then perhaps the endangerments which threaten the lives of smokers would be less severe, as they would receive immediate care and medical attention. Nonetheless, it would be an irrational ideology to claim that by prioritising smokers, then the illnesses and diseases which correlate with smoking would disintegrate. However, with efficient medical attention and quick responsive care, then perhaps smokers would have a greater chance at fighting for their lives and beating the diseases which are associated to smoking. Sadly, the act of smoking is an addictive habit, one which cannot easily be detached from everyday need and use. Sophie suggested that by prioritising non-smokers on hospital waiting lists, it may provide an incentive for people to cease smoking. If the fear of death and abominable diseases isn't compelling enough to break the compulsive hold smoking has on the individual, then this act would only decrease their life expectancy and add to the ghastly and grim reality of smoking. Sophie had also noted in her statement that the majority of smokers actually recognise tobacco as harmful to the human body, and 35 million smokers want to quit each year. Such a notion only complements the need for a prioritised hospital waiting list, as this figure indicates just how addictive smoking is and the alarming fear of diseases and illnesses which threaten 35 million people each year, as Sophie had noted. In addition, the fragile and threatened well-being and health of smokers is made clear by identifying the fact that the threats which correlate with smoking are additional threats to diseases and injuries caused by other factors, many of those involuntary, such as bacteria, parasites, genetics, as Sophie had mentioned. Thus, smokers are not only threatened by the numerous diseases and illnesses which frighten the entire population of people, but are also terrorized by the threats which are contributed from smoking, hence stating the desperate need for smokers to be prioritized on hospital waiting lists, as their life is undeniably at greater risk of developing serious and fatal diseases in comparison to non-smokers. To conclude, one may denote that by prioritizing smokers, people at greater risk of diseases and fatal illnesses, then we would be helping millions of people who are affected by this compulsive addictive habit, in hope of reducing the threats and percentage of deaths which are associated to this act.
Some solid arguments made there by Miray, although I have to rebut against the arguments made. From 2012, the most commonly diagnosed cancer for men was prostate and for females was breast cancer. The highest incidence rate for all cancers in 2016 showed prostate cancer to be at 25.2% of all new cancers amongst males and breast cancer at 27.3% among females. Cancers such as breast and prostate are often caused by involuntary factors such as advancing age and family history, whereas illnesses such as lung cancer and cardiovascular disease, the main cause of these diseases being smoking, a voluntary factor. Despite lung disease being a major killer caused by smoking tobacco, there are several other different factors which cause numerous other cancers, such as cervical, kidney, leukemia, and lymphoma, just to name a few. End-stage kidney disease is the most severe form of chronic kidney disease. To survive, people with this disease usually require kidney replacement therapy. Non-kidney replacement therapy medical management at end stage is another option for people who wish to prolong their lives, which is why patients such as these should be prioritized over smoking patients on hospital waiting lists. Tobacco kills nearly 6 million people each year, including 600,000 non-smokers who are dying because of their exposure to secondhand smoke, according to Action on Smoking and Health organization. These non-smokers, assumably healthy people, do not die by decisions made by themselves, but the poor decisions made by others. It is indisputable that non-smokers such as these people should have been prioritized on hospital waiting lists. If that were the case, I believe more lives could have been saved. According to the Daily Mail Australia, 1 in 20 hospital beds are occupied by someone with smoking-related illness. If the smoking demographic were to cease smoking, then this staggering statistic depicts the amount of medical care that would become more readily available to those who are in desperate need of medical assistance and treatment. Median elective surgery waiting times for patients in the urgent category can be 30 days. The urgent category is defined as being for a condition that has the potential to deteriorate quickly to the point that it may become an emergency. Many cancers and chronic disease can be cured with early detection and prevention programs and surgeries. But if smokers are being prioritized, elective surgery waiting times become longer, emergency waiting times become longer, more hospital beds become occupied, and many non-smoking patients with chronic diseases are forced to wait longer and may not get the chance for early intervention. It is not acceptable for smokers to be put before a non-smoker for a hospital waiting list when they would be expending the health facilities and programs when they were the ones who created their own problems in the first place. I feel that it appears overly evident that non-smokers should be prioritized in hospital waiting lists, as smoking is the #1 cause of preventable deaths. The 6 million people who die each year of smoking, which is almost equivalent to the entire population of Sydney, all of those deaths were preventable, including 600,000 non-smokers who tragically died due to smokers' negligence. This number will rise if we don't work on prevention programs for smokers, including prioritizing non-smokers on hospital waiting lists to essentially act as a form of prevention.